When you turn to a medical professional, you want to believe you'll be truly seen, heard, and helped. But it's not always the case. But our next guest is making it her mission to raise awareness. Integrative medicine and wellness expert, Dr. Taz Bhatia, joins us now from Atlanta. Dr. Taz, welcome and thanks for being here.
Oh, I'm thrilled to be here. Thank you for having me.
Well, such an interesting story. Let's get right on it.
Yeah. So, Dr. Taz, thank you for being here. So now, there's a term that is gaining traction, and that is called medical gaslighting. Break that down for us.
Yeah, so gaslighting you may have heard of in other situations. It's coming up with all kinds of scenarios, different relationships. But at the end of the day, what it really is about is just being dismissed. If you have a concern and someone says, oh, that's ridiculous, or oh, that's in your head, or that's not important, and they dismiss it. Well, unfortunately, in medicine, it happens quite a bit. So our doctors are health heroes. We know we can count on them, but we have a system that honestly has failed them. And what it leads to is gaslighting and all kinds of cracks that really lead to patients not being seen and heard.
But I understand, Dr. Taz, that you experienced this firsthand. Tell us what happened.
I was starting to get joint pain and gaining weight and having hair loss. So I started this journey into trying to uncover and discover, what my health issues were. And unfortunately, I was gaslit the whole entire way.
Now, I understand at some point you were prescribed a medication, and if I understand it correctly, that medication almost killed you.
It did. So here's what happened in a nutshell. I went to my primary care doctor who thought it was stress and told me to get more rest and quit my shifts. I went to the GYN who thought it was hormones, didn't check hormones, said take this birth control pill. I went to the endocrinologist who checked labs and said, oh, you're fine, everything is fine. It's probably just something you need to watch, and maybe it's cosmetic, so go to the hair specialist. So I went to the hair specialist who walked in and said, you need to take this medication, young lady. If you don't take this medication, you're going to be bald in a couple of years. And I did what many patients do, what all of us do. I believed in the system we were all trained in, and I believed that I was supposed to take that medication. So here's the story. Like every medication, it has side effects, but there was no conversation around that and around my personal health. Well, my history is that my blood pressure historically runs low. I'm always low. And this particular medication drops your blood pressure even lower. And so one morning I get up, I head to the gym, and I work out, I do my thing, I take my medication, I get in the car, and the next thing you know, I pass out while I'm driving, and I crash my car. And when I came out of that experience, it was like I could have hurt somebody else, and I could have hurt myself. And it's time to stop playing denial and that this is not happening. And I have to get over my shame and get over the sense of guilt that I've done something to myself, and I've got to take this in my own hands. And that really began my entire journey of trying to figure this out, everything from a weekend course here to getting certified in nutrition to everything I've done ever since. And it's just continued and continued over the years. And that story is not just my story. It's the story for so many people out there where they don't feel seen or heard, and they're trying to get answers.
How can patients, what can they do better to help themselves to avoid this type of situation?
The first thing you want to do is really identify how you're feeling. What are the top 3 or 4 symptoms that are really affecting you, and limit it to 3 or 4. Once you've got that list down, let's move on to how is that really impacting your life or your quality of life, and maybe list down 2 or 3 different ways. Maybe it's affecting how you interact with your husband or your daughter, or how you perform at work. Once you've got that piece of information down, you want to go ahead and move on and talk about maybe what you can do and what the doctor is sort of communicating with you about what you can do next. Now, if that communication is not going well, the doctor's looking at their phone, they're not making eye contact, they're not really paying attention to that, then we know that that's probably not the best fit for you. And then also getting additional opinions and putting all of that information together to come up with a real good action plan for yourself so you can move forward and be an advocate for your health.
Really enlightening. I hope everybody listened up. Dr. Taz, thank you so much. And for more information on medical gaslighting, you can head to our website at thedoctorstv.com.